I talked about this earlier. I didn't bring a copy of this. I don't give this in my clinical practice anymore, but boy do I love this measure. The problem is this, 1.5 to 2.5 hours including scoring, and I don't think any of us have the luxury in our practices anymore to be able to give this, but boy does it give great rich information. It's planning, treatment, and distinguishing autism from other developmental disorders. That's where I really find it helpful, and where I still do give it clinically is when I'm having trouble distinguishing. So this is something that if I were in a forensic setting, I actually might do and go back and distinguish if I had good informants to do it. Gives a lot of information on things like the history of gesturing, all those intricacies that you'd like to get in a clinical interview, but don't necessarily have the time. I've incorporated some of these things into my standard clinical interview now that I have parents fill out before they come.
Now this is parent report, or this is, I mean, you're interviewing parents or you're interviewing patients?
Typically,
Oh,
yeah.
parents. Okay.
Yeah. This is one of my favorites, and it's part of my screening program. I actually have the copyright to be able to use this on my website on www.projectskip.com, and I love this measure. This has a current form and a lifetime form, and for a screening measure, I like it better than the MCHAT. Although the MCHAT goes down earlier in age. The types of questions that it asks: is she now able to talk using short phrases or sentences? If no, then you skip a bunch of questions, but you go on to say, has she or he ever had things that she seemed to have to do in a very particular way or order, or rituals that she or he insisted that you go through? Cutoff score is 15 for older kids. For younger kids, it's actually been validated down to 3 or 4 with a cutoff score of 12. That's actually in the literature. Your guidebook doesn't, your manual doesn't say that, but Christine Corsello, who's actually here at Rady at this point, they have validated it down to younger kids with a lower cutoff score. So I use a score of 12 for kids who are younger, and kids, I actually use it down to 2. With just a higher cutoff score. I start to look at kids around 11 or 12 symptoms. I start to use it as a cutoff score.
Can you compare this to the MCHAT just briefly, like likes, dislikes, what is it, differences in information it gives you?
I don't know that it gives you that much different information, to be honest.
Okay.
I think it's the age that really is helpful. We'll pull up the MCHAT and look at it. We can do that right after the break, because I've never found it to be that much different. The studies behind it I've just found to be different. Some of the questions I think are easier on the MCHAT for parents to understand. I think that's why the MCHAT's gained a greater acceptance. Mm-hmm. If you have parents where literacy is partially an issue, I'd probably go to the MCHAT. The wording on this sometimes gets really hard for even higher educated patients or families to understand. That's the one thing I don't like about this. The reading level on this, I've never known what it is specifically, but that's the part I don't love. But in terms of really being a little less, I've found the MCHAT to be more language-based, and so I have a lot of kids with the language issues who fail the MCHAT. But let's go back together and look at the specific items about why. That's my experience with it. A lot of kids who have a language issue fail the MCHAT and come in, and I don't feel they have autism because I feel it's more language-based. But that may be just my perception, so let's go in and test it. I use this instrument down to 2. Yeah, it's been validated down to 3 or 4 and reported. I use it in combination with the behavioral and emotional screening system, which has also been validated down to 3, but I have a fair amount of data set right now to 2. So if you go on my website, it actually prints out the results for parents right there on the screen. They just basically, they answer the questions and we can actually go in and look at it. But you answer the various questions, and when they press the button, it shows right there where they fall on both the SCQ and the behavioral and emotional screening system. And so it says at risk or not. And so if I see a score of like an 11 and the BESS is also elevated, I say go in and let's get a full eval if they're 2.